Yuhita Shri.
And I'm Vignesh Natarajan from grade 8.
We are from Aurobana Indian School here in Aristo Hospital, Kalavasal, Madurai, to interview Dr. Sheikh, Paediatrician specialist. We are going to ask him about the common fevers like cold and dengue and some virus like Nipah and pink eye.
Hi, good morning everyone. I am Dr. 𝒔𝒆𝒊𝒄𝒆𝒔. I am a pediatrician, consultant pediatrician in Aristo Hospital. Nice to meet Yuhita and Vignesh from Aurobana School.
It's a pleasure having an interview with you, sir. Doctor job it's one of the difficult job around here, and it's a great job actually. So we are going to talk about common diseases spreading nowadays, like in this season. Dengue, Nipah virus, pink eye, and common cold are spreading virally now. Can you tell the symptoms of dengue virus?
Dengue is a virus transmitted by mosquitoes from one person to another person. Okay. Actually, dengue spread by Aedes mosquitoes, which are usually daytime active.
Is it a specific species of mosquitoes?
Yes. Aedes mosquitoes will bite only during
Daytime.
early morning and late evening, during dawn and dusk. Okay. So, we children especially, we are only going to school in the morning time and coming back to our home in the evening time. That time is the peak time for Aedes mosquitoes. Okay. Symptoms is first fever, headache, eye pain, back pain, the severe back pain. That's why it's called break bone fever. Okay. The patient will feel like that his bones are breaking. That much severe pain will be there. That's why it's called break bone fever.
How long?
Another important symptoms: abdomen pain, vomiting, loss of appetite, very tiredness, and the cold peripheries. Usually our whole body will be in the same temperature. In dengue, we will feel less warmer or cold peripheries than our center or trunk, and there will be decreased in urine output. The motion will be changed to black or brown or red or frank blood, and we will have rashes all over our body.
How long do these symptoms last?
The whole duration of dengue illness is just 8 days only. First 3 days, it's a febrile phase. We used to have usually fever, headache, back pain, and that. Then the next 3 days will be the critical phase. The day 4, 5, 6 are the critical phases. In this phase only, we'll have abdomen pain, vomiting, cold peripheries, and decreased urine output, loss of appetite. The last 2 days is the recovery phase.
Okay, sir.
We will regain our appetite, we will feel energetic, we will drink more, we will eat more, and after 8 days, dengue will gone out of our body.
Okay, sir. Sir, the main reason why people are suffering in dengue is dehydration. Is it?
Yes. Dehydration is one of the cause.
Okay, sir.
There will be hypotension, blood volume will be low. There will be bleeding due to platelet function abnormality or platelet count decrease. Then
What causes is that red rashes or spots in our body, sir?
viruses usually have a common feature like fever, headache, and like that only. Rashes are more common in virus illnesses, especially in dengue.
Nipah virus. It is commonly spread in Kerala regions. And what are the symptoms of it?
Actually, Nipah virus is a type of virus transmitted from bats, pigs, and some other animals, like goat, sheep, and all, to humans. Okay. The commonest symptoms will be fever, vomiting, throat pain, especially ear pain, which is not found in all viral infections. Ear pain, one of the specific feature of Nipah virus. And we will have respiratory difficulty. In some rare cases, we may have encephalitis, which is infection of the brain. That may lead to death of the individual. That's why it's very severe and we are worrying a lot about Nipah virus.
Have you seen any cases of Nipah virus in India, Madurai?
No, not even a single case is reported from Tamil Nadu, I think. It starts in Kerala, and then the Kerala government is very active enough to contain the virus. Whenever they suspect Nipah virus, they will impose self-isolation, they will contain the area, avoid spread, they will take samples from each and every contact of the patients, they will treat accordingly because there is no specific treatment for Nipah virus. Prevention is the only mode of avoid Nipah virus.
Okay, sir. Pink eye. What is it affecting most?
Actually, pink eye is it's also a viral infection caused by adenovirus. Adenovirus affect a lot of parts of our body like eye, ear, respiratory tract, our urinary tract. But this pink eye, why we are calling it as pink eye now? It will affect the conjunctiva of our eye. Normally conjunctiva will be red. In pink eye, conjunctiva will be more red, and that's why it's called pink eye. We have to be very careful with those patients. We should not touch their eyes and ask them to do not touch any parts, any things, especially even handle of our doors and all. It will be spread by fomites. Fomites are the infected particles. We should not rub our eyes. We should not touch our eye and touch anything. That virus will be there alive for the next 30 minutes. The next 30 minutes, if anyone accidentally, unknowingly touch that area and rub or touch their eyes or mouth, it will spread them.
Sir, will it come because of direct eye contact with the person?
Direct eye contact is the very remote possibility. That fomite I said, like rubbing and touching things. That's the commonest and rapid route of transmission. Direct eye to eye contact spread is not proven. Okay, they are wearing glasses to avoid exposure to sunlight or other light sources, because there will be photophobia. Photophobia means fear of light. That will be pain during seeing bright objects, bright lights. That's why they are wearing specs, and wearing specs avoid unnecessary contact with eye, right? If you are wearing specs, you don't rub your eyes usually.
So it will stop the eye.
So to prevent light induced pain and to reduce contact with eyes, they are wearing specs.
Does it make our eyes blurry?
Definitely, because the clear eye will give us a clear look. Congested or increased vascular or painful, reddened, and there will be some X-rays like coming out of our eyes. White or yellowish white. Okay, this will cause our vision slight blurry, but that is not permanent. It is temporary. It will go off 1 to 2 weeks after we take care of our infections.
I'm going to ask you about common cold, which is otherwise known as flu, and why is it highly spreading around these seasons?
Okay, there will be viruses in the world, in and around ourselves, in the environment, all 24 hours. But viruses need some special or peculiar environment, like temperature. They need some cold temperature for their well-being or reproduction or spread. So that's why flu and flu-like other viruses. There will be corona, COVID. All viruses spread usually rainy season or winter seasons or cold seasons only.
So, around this time, a lot of viruses or some diseases are spreading. Now, which is the common disease or common virus you are seeing like every day? Each and every day you are seeing a case of it. What is it?
Uh, like you asked before, flu virus is spreading very common nowadays. Okay, the best way to prevent flu is vaccination, because there is no vaccine for Nipah, no vaccine for adenovirus, adeno pink eye. Okay, but we have vaccines for flu. Yearly once, 5 vaccines will give you lifelong protection against flu. Okay, then in every winter seasons or rainy seasons, or some people during all times wear masks. Wear masks. Mask is the only way, best way to prevent transmission of respiratory viruses or viruses spread through droplets infection from while we are talking, coughing, sneezing. Okay, so mask is the best way to prevent accidents. So vaccination, wearing masks are the 2 best ways to prevent flu viruses. Okay, and then if you have any symptoms like fever, cough, cold or throat pain, body pain, something, better you take rest. Don't go to school. Even it's quarterly exam or half yearly exam or annual exam, don't go to school. Okay, because you will spread to the close friends of yourself. Okay, 6 meters in and around, 6 meter radius. Whenever you talk, cough or sneeze, virus will spread. It will be there for the next 30 minutes.
This is the reason why a lot of cold is spreading around our school.
That's why cold and flu viruses are spreading very fast during our school timings, evening timings, shopping, restaurants, theatres. Okay, and that's why we closed our theatres, restaurants during COVID, right? Yes. To avoid transmission only. Okay.
In our class, there's a lot of people who got affected by jaundice.
This year, especially the post-COVID era, this year has a lot of jaundice, especially hepatitis A. There are many types of hepatitis. This hepatitis A is spread through fluids, contaminated food and water. Hepatitis A will cause fever, jaundice, abdomen pain, vomiting, yellowish discoloration of sclera and urine. Okay, so to avoid this, we have vaccines. Single vaccine.
This is the reason why our eyes are getting yellow, or they'll say yellow.
Lot of causes for our eyes getting yellow. Hepatitis A is one of the cause, and hepatitis A is the viral cause that can be prevented. Okay. To avoid hepatitis A, we should avoid food from outside. Homemade foods and water are the best way to avoid spreading hepatitis A. And we have to wash hands before and after eating our food or something.
Sir, is there any way we could prevent ourselves from getting any viruses?
So we cannot escape from all virus all time.
Okay, some few like specific viruses, like cold or something you said.
Okay, all cold viruses will be protected by wearing mask.
Okay, sir.
Or whenever there is a vaccine, we can have vaccine and protect ourselves. There is no definite way, other ways to protect ourselves from viruses.
Now we talked about a lot of viruses. Can it be treated at home?
Now all viruses, except something like COVID or Nipah, all viruses will have 3 types of illnesses. Asymmetrical. Asymmetrical means there will be no symptoms, but we have virus. Then next stage, mild stage, there will be only fever or headaches. The next stage will have breathing difficulty, continuous vomiting, or will be dehydration. Will have lung signs like wheezing or cold in our lungs. Okay, so this type of stages, except the first two stages like asymptomatic and the mild fever stage, other stages needs definitive
Doctor's consultation.
medicines or expert management, maybe admission or nebulization or some IV fluids or antibiotics something. All viruses doesn't need admission, and all viruses will not be resolve itself in the home.
Okay, sir.
Okay. It will be decided upon the symptoms the patient is having.
Sir, you said 3 symptoms. Which symptom we have to go and consult our doctor? In which stage we can go and consult our doctor?
Okay. Any fever lasting more than 48 hours and any fever not responding to our home remedies like paracetamol.
Okay, sir.
Then we have fever is increasing after 48 hours. After 48 hours, the fever spike is increasing, frequency is increasing, then we have to consult a doctor.
Okay, sir.
Okay. It may be a rare viral or a severe viral or some other infections which may need aggressive management.
Okay, sir.
So first 2 days home treatment, home remedies, okay. From day 3 onwards, you may need investigations or admissions or definite or appropriate management.
Thank you so much for answering all our questions, sir. We could end this session, sir. Thank you, sir.
Thank you, Vignesh. Thank you, Yuhita.
Thank you, sir.
And thank you, Aurobana School.
Thank you so much.